Okay, I'm going to be maintaining an intermittent infusion device today, and the first thing I'm going to do is I'm going to go ahead and wash my hands as I come into the patient room. And I would identify my patient, and I would ask them their name and their birth date, and I would go ahead and verify that. Because we have a potential to come in contact with blood or body fluids, I need to put on gloves. And I brought all of my equipment with me. So the first thing I'm going to do is go ahead and I'm going to look at the site. I'm going to make sure there isn't any redness, any swelling. I'm going to ask the patient if they have any pain or discomfort. Again, looking at the insertion site as well as the vein running alongside there to see if there's any redness, discoloration of any kind, and it actually looks very good. So the first thing I'm going to do is open the clamp on what they either call a J-loop or an extension tubing. If I look at the IV, this IV has a swab cap on it. So if it has a swab cap on it, as I take it off, you can actually see on the inside there's alcohol, so we would not have to wipe this with alcohol again before we flush it if it has a swab cap on. So I'm going to put that off to the side. I am going to demonstrate that if you came in and saw it did not have a swab cap on, then you would have to use alcohol and you would have to use a rotation motion back and forth for 15 seconds. Okay, I'm going to put that off to the side. I have my normal saline that has 2 milliliters in. And some facilities, just so you know, use more than 2 milliliters of normal saline to flush. So again, know your hospital policies. I'm going to take that off, maintaining the aseptic technique of the insertion site here, where I'm going to put that actually into the IV. I'm going to actually take that, and it's a lure lock, so we're going to press and turn all at the same time. And what we're going to do is we're going to aspirate back, and what we're going to do is look right here to see if we get a blood return. Okay, and as I pull back, I do get a blood return, so that means that I'm in the vein. If I would aspirate and I don't get a blood return, I would go ahead and push just a little bit of solution in to see if it causes them any pain. If you meet resistance and can't push anything in, it might be clotted off and we would have to start a new IV. But since we got blood return, I can go ahead and just push that 2 milliliters of normal saline in. And then I can take that off of there. Because it doesn't have a sharp on, I can throw that just in the regular garbage. Now, two different things. If we didn't have an IV push or an IV piggyback to put on here, I could put on my swab cap and I would be done. And I could also clamp this if that's all we had. But if we have an IV push or an IV piggyback, I would have to again use another alcohol wipe to wipe this again for our 15 seconds. Good, and I need to make sure that this is open. I'm going to grab my IV piggyback here. Again, maintaining the aseptic end here. And actually, let me use my right hand because I'm going to push that in and turn. Okay, and then what I would do is I would adjust my roller clamp or set my IV pump in order for that piggyback to go in. I also would put a piece of tape on here to stabilize this. Then in a half an hour, I could come back in. Our pump is beeping, our IV piggyback is done. I could go ahead and take this off. Go ahead and make sure that we have a cap to put on there. Again, I need to use another alcohol swab. And I would do that again for our 15 seconds using that rotation motion. Good, and I have another syringe here that I have my 2 milliliters of normal saline. I got all of the air out of my syringe. Because the IV piggyback just went in, I can know that it's patent, so I do not have to aspirate here. So what I'm going to do is I'm going to go ahead and just flush that line so that all the medication is in. Once my 2 milliliters is in, I'm going to untwist this. Okay, the next thing I'm going to do is close my clamp. The last thing I'm going to do is put my swab cap on. I'm going to take that off, and that just turns right on the end. And that comes off, and I'm good to go.